Advances in pain management have made many surgeries much easier to shoulder, among them shoulder surgery. Many patients are now able to get a shoulder replacement and go home the same day.
The transition from one day or several days stay after shoulder replacement to being able to even consider it as an outpatient was predicated on the idea of using some advanced anesthesia technique to be able to help manage pain.
Armed with an indwelling pain catheter, people can rest comfortably.
The anesthesiologist placed a small catheter in between several of the muscles in the neck where the nerves that exit the spinal cord and then enter the shoulder pass through. And what happens is that little catheter drips in a specific amount of numbing medicine over those nerves over the first 72 hours after the surgery, making the surgery essentially pain-free.
Pain management can be a deal breaker for someone considering joint replacement. Doctors find many people will live with severe arthritis rather than undergo an operation. The option of a safe pain reliever may take away some of the sting of surgery.
It's a very safe agent. It's a long-acting version of the same thing you'd get from the dentist, Novocaine or lidocaine. So it's a slightly longer-acting, more appropriate version of that same style of drug. And again, the side effect profile is extremely safe because none of it is getting into the vascular supply, so there theoretically is very, very little risk of additional injury or medical problem as a consequence.
Aiding the recovery effort are less invasive techniques which allow for smaller incisions that minimize muscular disruption and bleeding.
It's a radical change from where we were just a few years ago,
making the decision to get a needed operation less painful. For Lee Memorial Health System, I'm Amy Osher.